All right, welcome to our training about minimal sedation. This is meant to be a short, minimal update to our typical sedation training about the protocols we have for treating patients with our typical protocols for sedation. And so this is just a bit extra there. So let's move on. What exactly do we mean by minimal oral conscious sedation? First of all, we might use some other terms that are related to this. We might call it single dose sedation. We might call it anxiolysis. Those are all a similar way of describing less than our typical protocol for our oral conscious sedation. So just keep in mind that we might use other terms. If you're not certain what kind of sedation we're indicating, then ask another question. So what is it? What is minimal oral conscious sedation? Well, essentially, it's a single dose of medication taken before treatment. No additional dosing during the appointment would be expected, and it would be intended to simply take the edge off. In other words, there's a minimal expectation for how much sedation we would get from it to calm the patient's nerve. And just like using nitrous oxide, the patient will likely be more aware and awake, and they may remember more of what's going on, but it will still be of assistance to them. So how is it different from our typical sedation? Well, typical oral conscious sedation is considered to be moderate sedation. That's not just a clinical term, but it's also a legalistic term that's listed out in the board's determination of different levels of sedation. Typical oral conscious sedation involves multiple doses that are given over time, whereas minimal sedation is single dose. It's customized for every patient, whereas minimal sedation would be the same for every patient, just a single dose ahead of time. With typical oral conscious sedation, we can use multiple kinds of medication, even combine that with nitrous oxide, and we can't do that with the minimal sedation. And as well, with minimal sedation, any doctor with a license can do that, but if we're going to titrate it and customize that with multiple medications, then it requires an Arizona permit, what we call a 1302 permit. But almost everything else is the same. For example, we still treatment plan it. We still treatment plan it in their treatment plan. It still goes to the front desk. They still get it reviewed. They still have a health history that's reviewed. They still require a driver to and from their appointment. We still monitor them with their oxygen levels. We still take their blood pressure. We still document it in their clinical chart. We still make sure they're safe when they leave the office. We still use a wheelchair. Almost everything else is the same. And so the answer to do we do that kind of sedation is absolutely we do, but we reserve it for specific situations, and it's not considered our default. It's considered an exception to what our typical options or choices would be. So we might call this, in effect, basically a secret menu item. Kind of like In-N-Out, when you go there, you can get it animal style, but you only know you can get it animal style if somebody else has told you because it's not on their menu. The same way, this is actually available to everybody, all of our patients, but we don't necessarily want to make it an obvious choice because it's not always going to be the best option for the patient. So we want to reserve that for the doctor's discretion to offer that when we see that that is going to be the best option. And one of the reasons why we don't want this to be upfront and aware to every patient is because there would be a lower cost for this kind of sedation, and we don't want the decision in what kind of sedation to pick to be cost-driven. We really want it to be the best clinical outcome-driven, which then becomes the decision of the doctor. So if moderate conscious oral or IV sedation has been recommended, but the patient then expresses concern due to the cost of that sedation to the front desk or to the assistants after the doctor has kind of left the conversation or after he's recommended that, this option, the minimal sedation, should not be an automatic alternative offered to the patient. But it can be offered to them once the doctor's been made aware of that concern and he's reviewed the situation and determines that, okay, yes, I can return to the patient and make that recommendation. So then if it is something typical that we offer, then yes, there is a fee. And that's because there is a service to the patient that has real value for them. But like the fees that we have for our typical moderate oral conscious sedation, it does have some flexibility to it as needed. So it can be adjusted by the doctor. In some cases, it might even be considered to be offered at zero cost, but that shouldn't be our default, and that shouldn't be the way that we approach and offer it to the patient. So what is the fee? Well, at the time that I made this presentation, we didn't quite have a code, but we do now. There's a code in Dentrix. If you're not certain what that is, ask the office manager and she'll bring that up for you. But we're offering it at $65 as a typical fee. And we've set that because that's in line with our fees for nitrous oxide, because it helps people at about that same level. All right. That's all for our presentation here. If that brings up more questions, then please ask those to the office manager or to one of the doctors. We want to make this simple. We want to make it clear. And I think there's been some confusion before now exactly what this kind of protocol and how it fits in with our typical options. So thank you.